Hi, I'm Dr. Greg Relo with Express Dentist, and here to talk a little bit about charcoal toothpaste because this is something that we get asked fairly frequently. And obviously, a lot of people want to have a nicer smile. They want their teeth to look brighter and whiter. And teeth do have this tendency to absorb color over time, and it comes from the compounds that are in foods like coffee and tea and chocolate, wine, grape juice. Anything like that, slowly those little color compounds, not only do they attach to the teeth, but they actually embed into the enamel. So we have a discoloration that may not only be on the surface, but also soaking into the teeth in a sense. You can imagine this happening many times over the years as it starts to accumulate. So naturally, if you look for solutions to brighten your smile, you'll find charcoal toothpaste. There's quite a bit of it on the market. But as a dentist, I have to caution you against using charcoal toothpaste, especially when there are other options that are proven and known to work really well. So activated charcoal is a charcoal that's undergoes high pressure with oxygen, and there's very fine particles that are ground and then added to toothpaste. And there are some uses for charcoal toothpaste, but it may not really be for your teeth. See, when they add it to toothpaste and you use it on the teeth, you're basically using it to abrade or scrub away stain. So over the first month, you could notice a whitening effect, although a study in 2019 showed that whitening toothpaste, other formulas, non-charcoal, actually were more effective than the charcoal toothpaste, even at that initial whitening. And so you will see some whitening in many cases, but it's because you're abrading away that surface stain that we talked about. Here's the problem. You're also abrading away enamel, and you won't notice that at first, but enamel slowly is affected by that scrubbing action with these fine abrasive particles. And another set of studies has shown that what actually happens over time is that your teeth turn darker because you wear away that enamel, and then the teeth start to absorb that dark charcoal into them and they start to turn gray. So if you're using charcoal toothpaste for an extended period of time, you may actually get yourself into some serious trouble. And by the way, enamel does not grow back. And so once you wear that away, it is gone, and that leaves you more susceptible to other problems as the years go by. Also, if you are abrading the teeth with something, you're probably also abrading the gums. And gums are very thin, very delicate, and sometimes people just wear their gums away by scrubbing with a normal toothpaste. They're just scrubbing too hard with their toothbrush. But if you add something that's a little more abrasive, you may actually start to abrade the gum tissue away as well. And then what happens is you expose the underlying tooth, which is a little different than the enamel that's above the gum. It's even softer. And so now you're wearing that away. So this could turn into a very abrasive issue that could get you into a lot of trouble. So it's important to look at the science and to see what actually works and what may be detrimental over time. So what does work? I suggest that you stay with the peroxide-based products from reputable brands, reputable sources that they've been stored properly, haven't gotten too hot, for example. They do need to be kept cool so they don't break down. But these peroxide-based products typically are very safe if they're used according to the directions, and especially under professional guidance. Now, they won't whiten crowns or bridges or fillings, but in many cases, they will remove the majority of the discoloration. It takes a little bit of time, but if they're used, again, according to directions, it's very effective. And guess what? They're not abrasive. So you're not necessarily scrubbing the teeth with this. You're letting it sit against the teeth. And here's another thing. Not only does it remove that surface stain, but remember I talked about the embedding of stain deeper into the enamel, those little color compounds. So peroxide has the ability through a reaction to grab onto those color compounds and pull them right out of the teeth. And that is very effective then at whitening just beyond scrubbing off surface stain. And so I would suggest that you use peroxide-based products, but it's also always a good idea to make sure that discoloration isn't from something else that's going on. In some cases, people have had cavities and they think that putting whitening gel on the cavity will remove, quote, the stain, unquote. But it's always good to start any whitening process with a current checkup. Make sure you've seen the dentist and that they've checked for any issues that might be going on that could affect the whitening process as well, or may not be responsive to the whitening process. So here at Express Dentist, we have a trusted network of dentists that we can refer you to, help you get in to see somebody that can check everything out, make sure that you're healthy and that you're good to go with whitening, and they could discuss this even more with you, what might be more effective to give your smile a boost. So feel free to reach out and keep smiling.